The Human Patient Simulation Program at the University of South Alabama Division of Health Sciences provides multidisciplinary simulation learning opportunities at its 4 locations in the Mobile and Baldwin County area. The Emergency Medical Services Training Program uses simulation for paramedic students in their final semester. Students undergo a rigorous classroom instructional path, and the use of simulation helps them to immediately apply what they have learned on simulated patients. EMS students participate in childbirth and pediatric megacode simulations. Through this interactive approach to learning, students are more adequately prepared upon graduation, at which time they are expected to work independently with patients. It is essential that the students' psychomotor skills and critical thinking abilities are intact, and simulation helps to accomplish this goal. EMS faculty have received an enormous amount of positive feedback from its students who have commented that the simulations were challenging and left them feeling better prepared to work in the field. The Department of Speech, Language Pathology, and Audiology use simulation in its graduate programs for critical care orientation using high-fidelity simulators. This experience gives students exposure to critically ill patients in the acute care setting, a type of patient that they may be called upon in the future for consult and treatment. Students report that this experience increases their comfort, knowledge, and confidence within the critical care setting. Simulation with high-fidelity simulators has also been used to train speech pathology students in the technique of tracheostomy care and suctioning. These exercises give them the confidence and practice they need before performing these skills on real patients. The Department of Physician-Assisted Studies uses simulation for first and second year instruction and training to educate students in both skills and diagnostic clinical decision making. Simulation adds a level of clinical relevance to the first year didactic curriculum. Students have the opportunity to assess, diagnose, and treat simulated patients suffering from endocrine and cardiac diseases, and skills such as, but not limited to, lumbar puncture, intubation, ear examination, and chest tube insertion. One PA student remarked, "We can read about skills and diseases, but what cements the skills to the disease process is the hands-on experience we can incorporate into our armamentarium for clinical practice." The Department of Radiologic Sciences uses simulation in their first and second year curriculum to train students in the skills needed to become qualified professionals. First year students have the opportunity to learn and practice skills such as IV insertion, vital sign performance, and enema insertion on high-fidelity simulators. Second year students practice their cardiopulmonary resuscitation and advanced cardiac life support skills in a simulated hospital setting and are evaluated on their abilities to handle a critically ill patient. Radiologic Sciences students have expressed feeling more prepared to enter the practicum portion of their curriculum, in which they are expected to perform these skills on real patients. Under the leadership of the Vice President of Health Sciences, Dr. Ron Franks, students of the Patt Covey College of Allied Health Professions also have the opportunity to come together with nursing and medicine and observe simulated scenarios to enhance multidisciplinary professional learning. In these seminars, simulation is used to demonstrate positive and negative professional and ethical behavior to stimulate conversation across disciplines.